Hello, my name is Balendran and I'm presenting our work on the perioperative oxyhemoglobin saturation and oxygen therapy in orthopaedic surgical patients at Addenbrooke's Hospital. This was an audit of oxygen saturation in patients during the first and second major COVID-19 peaks. Oxygen was an important resource during the COVID-19 crisis, with supply to hospitals attracting considerable attention during this time. Being mindful of this for all patients, not just those with coronavirus, helped ensure that supply met demand. Cycle 1 of our audit, conducted from the 30th of March to 26th April 2020 during the first COVID peak, found that this did not result in significant rates of oxyhemoglobin desaturation in perioperative patients. We have subsequently re-audited oxyhemoglobin saturation and oxygen therapy in orthopaedic surgical patients during the second pandemic peak to ensure standards were maintained. Results of Cycle 1 were presented at our departmental audit meeting, which reassured anaesthetists and promoted increased awareness about oxygen therapy targeted to clinical demand. For Cycle 2, between the 28th of December 2020 to 24th January 2021, pulse oximetry and oxygen delivery values were again recorded at discrete perioperative stages. These were preoperatively, the value immediately before surgery, ward-based recovery, and postoperative days 1 to 3, with an average value calculated across each day. Data were analysed using SPSS, which we compared with the results from the first audit cycle. Cycle 2 identified 107 patients of comparable demographics and anaesthetic risk to Cycle 1. There continued to be a low incidence of desaturation irrespective of oxygen therapy, which can be seen here in the table, with no significant difference between the cycles. Represented graphically, we can see the majority of our patients staying above the 94% line. Sustained low SpO2 was found for only 3 patients in Cycle 1 and 1 patient in Cycle 2, and most patients with more than 2 postoperative values did not desaturate. We also showed that oxygen therapy was prescribed economically, with no significant difference between the 2 cycles. In conclusion, our audit demonstrated that there was adherence to existing pre-pandemic guidance in our non-COVID surgical patients, with a majority maintaining saturations over 94%. This suggests that an economical focus towards oxygen therapy during uncertain times can be achieved for perioperative patients without significant impact on their safety. Subsequent BTS guidelines suggested accepting lower SpO2 targets of 90 to 94% in non-COVID medical patients, which our patient population would also meet. However, this also suggests considering hyperoxygenation, i.e. SATs greater than 97%, which we've addressed in Part 2 of our study. Such data will help inform trust policy, particularly should the need unfortunately arise again. Thank you very much for listening.